Good evening, everyone. I'm Amrita. I'm Amrita, a PhD student at University of Hyderabad, and I have been allocated as the TA instructor for the course Maternal Infant Young Child Nutrition. So, before I start, um, I would like to request everyone that please mute your audio and video throughout the class. Okay. This is said because a lot of people are here and we should avoid chaos as much as possible. So, for that, it will be better if you could all just mute yourself, and for the audio as well as video, whatever conversation we are going to have, it will be through the chat box. Okay. So this session is being recorded, so no one needs to use any AI tools for recording this session. And this video session will be uploaded in the YouTube channel, which you can all access later. Okay, so no need to worry about that. And just let's have an active assignment discussion session. So this session is going to be an assignment discussion session, but not the current year assignments which you all are getting, but the previous year assignment questions. I'm sure you must have all seen the lectures of Rupal ma'am for week 1. I hope all of you have done that. So, this uh, session is done to make you all revise through whatever is being taught in week 1. And we have a set of questions which were the previous year assignment questions. So, we will be discussing the previous year assignment questions here so that you all can revise and practice once more about what you have gone through in week 1 lecture. So, before you join this assignment session, it is very important, very crucial that you have attended the week 1 lecture. Then only you can answer the questions which we will discuss today. If you have not attended the lecture before joining to this session, it is of no use at all because maybe you won't be able to answer the questions. So, here, what we are going to do as a practice session, I will show you the question. I will share the screen, the presentation, and question 1 will come. So, you read the question, you will have multiple options, and you need to answer whatever you think is the correct option through the chat box. Okay, only through the chat box. No one should unmute their audio and start saying the answers. Okay, this is a practice session, and also to let you expose to other questions aside from your current year assignments. Okay, so whatever lecture you have gone through for the week 1, it will the questions are related to that, and it will be a good practice session if you all participate actively. Okay, so around 100 people have already joined. I'll just wait for 2 more minutes till 7:10, and then we will start. I'm not sure if more than 100 people can join or not. Okay. So I'm saying once more, this is not a current year assignment question discussion, but a previous year assignment question discussion. So don't get confused. And we are so this is a set of extra questions which you are getting aside from the current year assignment questions. So this will be helpful from your exam point of view, which you will be giving in April, I guess. So yeah, so just read the questions, think whichever is the correct answer. I will give you around 5 minutes for each question. You can think thoroughly and type your choice of answer in the chat box. Okay, then we will discuss after 5 minutes, we will discuss what is the correct answer to that question. Okay, Okay, so it's already 7:10 and I think more than 100 people can't join. So we'll just quickly start for the session. Okay. Can everyone see the slide? Please give a thumbs up or anything possible so that I can know that you can see it. Okay, great. So, yeah, let's start with the first question of today's session. You have 5 minutes, okay? So, to think thoroughly and okay, someone else has started presenting. Please stop it. I don't know what is happening. 1 minute. Yeah, okay. I guess now it's visible to everyone. Okay, so we'll start with the first question. If you have any doubts, you can ask me at the end of the discussion, okay? Or if you're unable to hear or if you're unable to see the screen, then just let me know in the chat box. I'll check it, okay? So, other than that, let's not disturb the class in between. And yeah, we'll start now. And yes, uh, today everyone is on time, and I will request everyone that for the upcoming sessions also please join by 7 to 7:10 so that we can start the class as early as possible, right? Okay, so let's start with the first question. Is it visible to everyone? Question number one? No? It's visible. Okay, great. From the thumbs up, I'm guessing that it's visible. Whoever are raising hands in the class, I can only know what is your problem when you write it in the chat box. So you can write it. Okay. I'm seeing the chat box continuously. So I can know whenever you want to discuss something with me from the chat box. Okay. So whenever you think you know the correct answer, start typing your correct answers in the chat box. Okay. And once you have given your answers, please do not keep giving multiple answers just because after 1 minute you are thinking that no, maybe this is not the correct answer, the other one is. So please give only one answer in the chat box. Okay. I'm thoroughly seeing who is giving what answer. So please do not repeat your answers. And around 101 people are there in the class. So I request everyone that please type your answers. Don't just attend the session, but be active throughout the session. Okay. I'm sure many people must be elder than me in profession, in education. So, with due respect, let's just have a good active session. This is only for your help in exams, that if you get exposed to more questions, it can be helpful to you. Like questions can come from anywhere, either from the previous year assignments or from your current year assignments or from the lectures. So be sure to be thorough for everything. Okay. Whoever, again, I'm repeating, whoever is raising their hands, please write down your query in the chat box. Actually, the problem is more than 100 people. I am unable to admit them. I don't know what is happening. The because that's the issue coming. I think in Google Meet, more than 101, it's not going. I'm trying to admit them, but it's not happening. No, it's Pratyusha. She's there, but I'm unable to admit her. So that's what I was saying, that it's always better if you are early to the class. Now, above 100, I'm unable to accept anyone. I'm so sorry. Like, I don't know. We are only given the option to use Google Meet for the class. However, whoever is not able to join, they can do we have any marks because my other class? No, there are no marks for attending this session. So, in case whoever is missing the class, this whole session is being recorded by me and I will upload it on my YouTube channel, and you will get the link for the YouTube channel video through the NPTEL team. So, no need to worry. So, you can inform your other classmates that please try to join at 7 o'clock sharp so that you don't miss the session actively. But later, I like, just in case if you're missing it out, you can go through the video, through the YouTube video, okay, later. It is getting dismissed because the population has exceeded beyond 101 in this class, that's why. Okay, they can whoever are unable to join, they can go through the, like, this assignment session later through the YouTube link. Okay, it will be provided to you within 1 week, so no need to worry about that. But just because it's being recorded, please don't miss the sessions, because it's always good to practice when you are live in the session with me rather than just seeing the video later, which will obviously be boring, right? Okay, has everyone given the answers or should I wait for some more time? I'm sure now NFSH 5 data is already available, but because this is a previous year question set, we will be discussing only about the NFSH 4 data. I'm sure in the current year lectures, NFSH 5 data related things are discussed, and the question and the assignments given to you are also related to NFSH 5 updated data, right? Was okay. Many people are trying to join, but I'm trying to allow them, but they are, I can't. So just whoever has joined, they are lucky enough because they joined early. So please just inform your classmates. Okay. 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 People are still answering, so I'll just wait for 2 more minutes. But whoever is joining the session, it is being recorded. The NPTEL people are always monitoring that whoever is having joining the sessions continuously, because I have to give report for everything. Whoever has joined, who didn't join, everything has to be reported to the NPTEL team. So it is always better if you can make out some time every Tuesday from 7 to 9 p.m. and join the session with me. Okay, it will be very helpful to you all. Okay, many people are saying 35% is the answer. Other people are also there who have given other answers. We will see which one is the correct one in some time. I don't see 101 answers in the chat box though. Why so? Whoever is left, please start answering. I don't think it needs a lot of time to be answered. Almost all the questions are direct. I'm giving maximum of 5 times. It's not a 3 hour session, it's a 2 hour session, and it's not necessarily 2 hours. We can finish it as much speed as possible. It is all based on you. How quickly you are answering and how everyone is answering quickly. I can't finish the session before 1 hour. But it's not mandatory that I have to do it for 2 hours. But you have to be there till the last question. And I can only go to the last question if you all answer and participate actively. Right? So, yeah. So, one Once in a week, I think you all can make out time because you all have opted for this course. Obviously, due to some good reasons, you want to learn about maternal um, care and infant care. So, yeah, this is a very good course, and I am sure Rupal ma'am is taking good lectures. I myself attend her lectures. So, yeah, 7 to 9 p.m. is my OPD timing. Oh, okay. Okay. So, yeah, I can't help it. Then you can, if you are available, then fine. If you are not available, you can just go through the video later. Okay? Not an issue. Or else you can join and just keep hearing the session, no problem. You can find Rupal ma'am's lecture on the NPTEL website. Assignment will have other question than explained in video 1. No, assignments will be these whatever assignments I'm discussing, it is all related to week 1 video. Okay? Only week 1 video. Every week we are going to discuss one week. Okay? Cannot view question paper. Which question paper are you talking about? Okay, so it's high time. I think whoever wanted to present, they have, whoever wanted to answer, they have done. So the answer is 20% actually, not 35%. It is maybe through NFSH 5 data, but for the NFSH 4 data, how many children under 2 months of age in India are actually malnourished or too thin or wasted is 20%. Okay, so here you can see what was the question? How many children under 2 months of age in India are acutely malnourished or too thin or wasted? So here the you can see the stats. The yellow bar indicates the NFSH 3 data and the blue bar indicates the NFSH 4 data. So here it is given for stunted growth, for wasted growth and for underweight as well. Okay, so you can check the slide later. So let's move on to the next question. As per NFSH 4 data, how many children are born stunted or short at birth? 34.3%, 45%, 28%, and 67%. Class will be only once in a week, that is at on Tuesday from 7 to 9 p.m. Okay. Uh, okay, I'm again admitting few people. Let's see. Is the attendance? Yes, the attendance is being tracked for every Tuesday session. I have to send the report to the NPTEL team of how many people joined. Okay, so yes, it is being tracked. Is the live session not about practical problem faced and its solutions? No, the live session is only to discuss the previous year assignment questions. Okay, question paper you were discussing. So whatever uh, question you can see through the presentation, that is your question paper. Other than that, I don't think you can get access to the old year questions in a PDF format or anything. Is anyone unable to hear? Is it the problem with everyone? Is everyone able to hear my voice? Can you please give me a thumbs up? Okay, Basima, Vaishnavi, they all gave thumbs up. Where can I view the question? I'm presenting the slide. I hope it is visible. Shrikanti. Kavya, can you please mute your audio? If you're unable to see Shrikanti, please, I think, exit the class and join again, because I think everyone else are able to see the question. I think it's a problem with you, so please exit the session and join again. So, if you all have attended the week 1 lecture, maybe you should answer this question for NFSH 5 data as well. So, if you are saying whatever your correct answer is for the NFSH 4 data, what do you think will be the percentage for children born stunted or short at birth for NFSH 5 data? If anyone knows, please write down in the chat box. Do you all know? Have you attended the current year lecture? Please just write NFSH 5 data hyphen percentage so that I can know that it is for NFSH 5 data you are writing. Okay, Shivani says it's 28%. I think this is your question for the current year assignment as well. So you will get the solutions for the current year assignment. Just make sure you do it on time. I think there is a deadline for every assignment given, right? Whoever are raising their hands, please just let me know your query in the chat box. Okay. Okay, some are saying 20%, some are saying 35, 36%. Let's see what is for NFSH 4. So for question number 2, everyone has given the answer. Should we see what is the correct answer? Okay, let's see what is the correct answer to question number 2 first. The correct answer is 34.3%. So, as per the NFSH 4 data, the percentage of children who are born stunted or short at birth is 34.3%. So, the same thing here you can see here, the average is given around, the percentage is not exactly the uh, to the one given in the graph, but it is almost same. It is given here 38% for the NFSH 4 data for stunted growth. Okay, moving on to the next one. Which of the following is a cause of stunting in babies? Exclusive breastfeeding for the first 6 months, feeding colostrum milk within the first hour of birth, feeding complementary food at 6 months of age, and last one is ineffective breastfeeding practices. So, yeah, question number 3 is here. Start writing your answers. Just you can write option one, 2, 3, 4 like that. No need to write full thing as well. Okay, I can understand. Okay, almost everyone is saying option 4. We will see. Okay, is everyone done with question number 3? Should we discuss what is the correct answer? I guess I have given enough time. So let's see. Yeah. So the correct answer is yes, D. I think everyone has given the correct answer. It is ineffective breastfeeding practices. So the main cause for stunting in babies, stunting generally means short height, which is the general cause for this in babies is ineffective breastfeeding practices. So, what do you mean generally by ineffective breastfeeding practices? So, first of all, the breast milk is very important for the infant because it is having a mix of ideal nutrition consisting of vitamins, proteins, fats, and antibodies. Whoever knows what is the antibody present in colostrum? You can write it down in the chat box. Let's test your knowledge. So, the breastfeeding technique is very important when you are feeding the baby, right? So, if you are unable to feed the baby properly with proper positioning, attachment, and suckling, this is when it is called as ineffective breastfeeding practices because the baby is unable to get the adequate amount of milk. Although you are trying to breastfeed the baby because your position is not correct or it is not the baby is not attached to the nipple properly, then it happens that there is improper positioning. These all are called as ineffective breastfeeding practices, which results in the inadequate intake of breast milk that leads to poor weight gain, stunting, and declines immunity. Right? Yes, it is IgA which is present in the colostrum. So, what is colostrum exactly? Who can tell me? Watery. Yes, it is the first milk which comes out of the mother's nipple for the baby. It is called colostrum and it is very important for the baby because it is rich in antibodies, which we call it IgA. It is a very important source for baby's immunity, right? Okay, we'll move on to the next question. Yes, it is yellow in color, right? Okay, moving on to the next question. Formula milk is highly ultra processed food. True or false? Everyone is saying true. Obviously, formula milk is, we'll see that. Is everyone done answering? It was a very easy question. I don't think it needs 5 minutes for you to think and answer, right? Okay, so let's see the correct answer. The correct answer is obviously true. So the formula milk is the one milk powder which is available in the commercial market, which is generally used to feed the babies. So yeah, so I don't think this question needs any explanation. Yes, it is a very highly ultra processed food generally designed for babies and are commercially available in the market, right? So, question number 5. What should be given to the babies for 0 to 6 months of age? Cow milk, formula milk, breast milk, or water? Breast milk, is it? You think for 0 to 6 months of age only breast milk is needed? Okay, we'll see that if it's true. I don't see 100 people answering to the questions. So, this assignment discussion will be a waste of time if you are just seeing the lecture, because it is a very boring thing. It's always good if you think the question in this live session, what should be the answer, and answer it in the chat box. Then only you can make it interesting for all of us, right? Whoever is raising a hand, please write down your query in the chat box. Is everyone done? I'll wait for 1 more minute. If anyone wants to answer, they can write down in the chat box. Where do we find the assignments for the each of each lecture? Wherever you are going to find your lecture, there only. In if you go a little bit down, you can see assignment or quiz. It is written quiz, I think. Okay. So yeah, let's see what is the answer to this question. It is breast milk. So babies of 0 to 6 months of age are only advised to be given breast milk. Okay. Let's move on to the next question. As per the NFSH data, what is the exclusive breastfeeding rate in India? 50%, 62%, 43%, or 39%? So, whoever wants to leave the class because they want to do something else, they are most welcome. They can leave the class if they have something more urgent on this time. But yeah, and they can later see the video, no problem. But whoever is available, I will wish that they go through this 1 hour or 1.5 an hour session with me. Okay. This session is designed for 2 hours because so that everyone can get enough time to understand the questions and go through the questions, and I maybe memorize the answers as well, so that you don't need to come back to this video again till your exams. Right, this is the motto of this 2 hour session. Obviously, if I discuss the questions faster, it won't even take 1 hour. But I'm giving time to each question so that it fits in your brain and you don't need to go through the video once more. Obviously, we all have busy lives, we are busy in some or the other profession we are following. So, yeah, let's just give time to this session. Every Tuesday, just 1 hour or more than 1 hour. Obviously, it will take 1.5 an hour almost, and just get it done through it. Okay, you don't need to go back to this questions again. So, whoever is missing, they can go back through the video again by the YouTube channel. But whoever are attending throughout the session, so that you can complete the set of questions and you can remember everything whatever we have discussed today, so that you don't face any of the issues during the exams, right? You all are here because you need the code certificate, I guess. So yeah, let's help each other out through this session. Yeah. Okay, so some are saying 50%, some are saying 62%. We'll see. Okay, let's see what is the answer to this question. So the correct answer is 62%. So whoever has given the answer is 62, they are correct. It's not 50%. So the exclusive breastfeeding rate in India is 62%. So here you can see the graph which I have shown here. So first of all, as we discussed, breast milk contains all the nutrients needed by children in the first 6 months of life and is a source of uncontaminated nutrition. So it is always recommended that for the first 6 months, the baby is given only breast milk and nothing else. This is what is called as exclusive breastfeeding. So here you can see for the first 6 months, only exclusive feeding is needed, and you can see how the percentage is going down with the age. Okay, so the ages around the percentage according to the NFSH data is 62%. Okay. Okay, moving on to the next one. What is the most common cause of exclusive breastfeed babies not gaining weight? Due to inadequate knowledge about breastfeeding skills in mothers and healthcare workers, mother's psychological factors, baby is too sick, mother becomes pregnant while she is still nursing. So, what could be the possible option for the exclusively breastfeeding babies also not gaining weight, right? although they are getting the correct nutrition because they are being exclusively breastfed, but still they are unable to gain the weight. What could be the possible reason? Think and answer properly. Okay, all of the above. Okay, we'll see that. Whoever has unmuted, please mute Shalini, I guess. Yeah, thank you. Okay, I missed a question someone was asking. Madam, do we need to attempt assignment after attending all week 1 class to get better result, or each video has assignment? This is asked by Achala. Okay. Madam, do we need to attempt assignment after attending all? Yeah, for if you're asking about your current year assignment, yes, after you attend the week 1 lecture, be thorough with the lecture and then you can attempt assignment 1. You don't need to wait for this session to attend your assignment 1. Obviously you have a deadline to go through. If the deadline is later than this um video session, then yes, you can wait for the video session and after that you can go to the assignment and attend it. Obviously it will be easy for you to answer the current year assignment questions once you go through this session of us, right? And yes, every week will have one set of assignment questions for that particular week. Like today we're discussing for week 1, next Tuesday we will be discussing week 2, right? I hope I have answered your question. So yeah, I think most of you have given the answer. Let's see. The correct answer is A. Due to inadequate knowledge about the breastfeeding skills in mothers and healthcare workers. So this is mainly a problem in India, especially that although they know that for the 6 month baby needs only breastfeeding, they don't know or they are not well educated about how the breastfeeding technique should be done by the healthcare workers. So, already I told you what are the inadequate breastfeeding practices, right? There should be proper attachment and proper sulking of the baby. Then only the adequate amount of milk can be given to the baby. Although you're thinking you're breastfeeding the baby, but if your position is not correct, if the attachment is not correct, the baby is not getting the nutrition it requires, right? So, the main reason for the exclusively breastfeeding babies also not gaining weight is the inadequate knowledge of the mothers. Okay, so moving on to the next question, how can diarrhea be treated? By giving zinc tablets and ORS, by giving goat's milk, by avoiding to give anything to the baby, by giving honey and water. Start answering. Still, some people are trying to join. I can't, I'm unable to let them join. So, please, if they keep coming to ask you, just let them know that please be on time. If you are among the first 100 people, then you are done. Okay. So, the setting is done so that don't be late to the class. Someone asked a question, I guess. Please explain latching. Okay, so latching is a technique. So who can answer it? So who has asked this question? Let's see. Soma Chakravarti. But I think it is already discussed in the lecture. Let's see who can answer what is latching. Is there anyone out of the 101 people attending here who can answer Soma's question? What is latching technique? No one knows what is latching. Ujjwala has answered proper attachment of the baby's mouth to the nipple. Okay, what else? Latching is a technique by which the baby, yeah, so many answers are coming. So, yes, it's correct. Whoever is giving the answers, it's correct. So, generally, if we say in the layman language, it is the proper how the baby attaches to the breast while breastfeeding. It is called as latching. So, if the baby has to be comfortably positioned so that the baby gets enough milk when it is sucking through the nipple, right? It is called as latching. Okay. So there are, so people have already written how to latch a baby so that it is it is comfortable as well as it is getting enough amount of milk required, right? So also there is a proper position how to latch the baby in which position and how to know that the baby is in proper position. There are techniques to observe it as well. We will be discussing it further. Okay. Yeah, like how much areola and how much nipple it should be sucking, it is given, right? Okay, so let's see what is the answer to question number 8. It is A, by giving zinc tablets and ORS. ORS, we all know that it is helpful in treating diarrhea. It can also be given to the babies as well as zinc tablets, right? Moving on to the next one. Wasting, stunting, and underweight can be prevented by exclusive and effective breastfeeding and initiating nutrient dense complementary feeding at 6 months of age. True or false? Read the question properly and then answer. Yes, true. You all think it is true? Okay. Okay, let's see what is the correct answer to this question. It is true. Yes. So, if the baby, if you want to prevent your baby from being wasted, stunted, or underweight, you should go through the exclusive and effective breastfeeding technique for the first 6 months. And after 6 months of age, you should start giving complementary feeding. So, what is complementary feeding? When you start including other foods other than just breast milk, After 6 months of age. Yes, after 6 months, you should continue breastfeeding, but with breastfeeding, you should add other foods to complement it, because after 6 months, only breastfeeding won't be sufficient to give proper nutrition to your baby, right? Moving on to the next question. As per NFSH data, which state has the highest rate of initiation of complementary feeding between 6 to 8 months of age? Manipur, Kerala, Haryana, Punjab. Start answering question number 10. Okay, one more thing I forgot to tell. Please keep noting down how many correct answers and how many wrong answers you're giving. At last, we will see how many marks you got out of the total number of questions. Okay, so that is also being recorded. So try to think and give correct answers only. Okay, so I don't remember how many total number of questions are there, but yeah, I think around 20. So out of 20, how many correct answers you got, we will know at the last. Okay, so keep tracking your number of correct and incorrect answers. Okay. Yes, for exam you can get NFSH 5 data as well as NFSH 4 data, so go through both. Okay, like exam paper is not set by me, it is will be set by the uh, instructor, like by Rupal ma'am. So she can, maybe if she is discussing in class NFSH 5 data, you can get that. And as well, because we are discussing we are told to discuss previous year assignment questions, you can get NFSH 4 data as well. So it's better that if you go through both, right? At 6 months is correct phrase, or after 6 months is correct for complementary feeds. For complementary feed, it is after 6 months. Okay, for the first 6 months till 6 months is completed, it should only be complementary feeding. From the seventh month, it should only be, sorry, exclusive breastfeeding for till sixth month. From the seventh month, you can start with your complementary feeding, right? Okay, let's see what is the correct answer. The correct answer is Manipur. So, the Manipur state has the highest rate of initiation of complementary feeding between 6 to 8 months of age. Okay, so here it is written. You can see the explanation for the question you have asked. After the first 6 months breastfeeding, breast milk is no longer enough to meet the nutritional needs of the infant. Therefore, complementary foods should be added to the diet of the child. So, appropriate complementary feeding should include a variety of foods to ensure that the requirements for the nutrients are met, like fruits and vegetables, which have a lot of vitamins in it. Okay. Moving on to the next question. So here questions for the NFSH 5 data we will be discussing now. As per the NFSH 5 data, how many children receive minimum adequate diet? MAD. 11 to 12%, 5 to 6%, 30 to 31%, and more than 50%. Which do you think is the correct answer? Is everyone done? No, people are still answering. I'll wait for some more time. But I'm happy to see that most of the people are trying to answer. And yeah, keep tracking how many correct answers and how many wrong answers you're giving. No one is going to punish if you have more wrong answers. Just it is for your knowledge. Okay? That it shows how much thorough you are for the week one. Right? Okay. Let's see what is the correct answer to this question. It is A, 11 to 12%, right? So, what is MAD? Infants and young children should be fed a minimum acceptable diet, also called as MAD, to ensure the appropriate growth and development. So, it is an indicator that this much diet is acceptable and it is required for the appropriate growth and development of the baby. So, the WHO has recommended the minimum acceptable diet recommendation, which is a combination of the dietary diversity, so the diverseness in the diet, as well as the minimum meal frequency. How many times should the baby be given a meal is different for breastfed and non-breastfed children. Here you can see the graph as well. You can go through this graph and remember the numbers later. Okay. Moving on to the next, as per the NFSH 5 data, how many children receive minimum adequate diet in Gujarat? So this question is specifically for Gujarat. Okay, where are the videos and assignments? It is in the NPIT. So you have joined the course, right? So when you go through if you have joined the course for the maternal infant young child nutrition, if you search it in the NPTEL website for this course, then you will get everything, right? You can get the course when you go to the courses section, I guess, or the assignment. I don't remember exactly. Yeah, many panels are coming. If you click in one panel, there are the lectures as well as the current year assignment questions, and there is also a deadline for the current year assignment questions. And also, every Tuesday, maybe Monday, every Monday, you will be getting a reminder for the Tuesday session as well. Okay, and maybe also if you have registered through your email ID, you will be getting notifications through email as well for the sessions. I'm not sure if you're getting email for the uploaded lectures, but yes, you should get. Already, I think week 0, week 1, and week 2 lectures are already available at the NPTEL website. So please go and check it out. Okay. 10%. Many people are saying 10. Okay, some are saying 20 as well. We will see which is the correct one. Ma'am, how will we know how many correct answers we have given? Because I'm telling you the correct answer here, right? So that's what I'm saying, to note down that if you, how many, if you're like, either you can keep a notebook with yourself and keep writing one, correct or not, like that. You can track your number of correct answers and incorrect answers, and you can let me know at the end of the discussion, because there are more than 100 people. I can't keep track of how many correct answers and wrong answers you are giving, right? I can go through the video recording session later and check if you have told me the correct number or not for your incorrect and correct answers, but not now currently, right? But it will be checked later. So yeah, keep tracking how many correct answers you have given and how many wrong answers you have given, and write down your score at the end of the session. Okay. So yeah, let's see what is the answer to question number 12. It is 5%. So the minimum adequate diet that children receive in Gujarat is only 5%, given by the NFSH 5 data. So I think many people are wrong here who have said 10% and 20%. Okay, let's move on to question number 13. What does the Nutrition Rehabilitation Center do? Takes care of acutely malnourished children under 5 years of age, takes care of pregnant mothers, takes care of adolescents, takes care of the elderly. Think properly and answer. Okay? What does a nutrition rehabilitation center do? Whoever is unable to see the question, please exit the session and join again. Because I don't think it is problem from my side. Okay, because other people are able to see it. Right. Okay, let's see what is the correct answer. It is A. I think everyone has given the correct answer to this question. Nutrition Rehabilitation Center takes care of the acutely malnourished children under 5 years of age. Right? So here you can see there's a photo given for how a nutrition rehabilitation center looks like. It is written management of severely acute malnourished children. So what is the overall aim of this program? It is to improve the nutritional status of children through provision of quality, health, and nutritional care to children below 5 years. It is only below 5 years of children. This in turn helps in timely action of the facility, community, and household level to prevent and treat malnutrition. So, the main aim is to treat malnutrition. For that, these rehabilitation centers are being made for children below the age of 5. Right, it's a very good initiative. Okay, moving on to the next question. Question number 14. In NFSH 4 data, stunting increased from 19.11 percentage in under 6-month old babies to 24.8% in 7 to 12-month old babies. What could be the reason for this? More babies are born, more breastfeeding, complementary feeding was not started after completing 6 months of age, formula was not fed. Okay. Okay, Mahalakshmi, I don't know what to do. Like, I think for my side, my internet connection is very good and other people are able to see. Is anyone else facing the problem of not seeing the slide other than Mahalakshmi? Okay, let's see what is the correct answer. It is C. Complementary feeding was not started after completing 6 months of age. Right? So, What happened? The stunting in percentage increased from 19% to around 25% after the babies are of 6 months. So obviously the reason is complementary feeding was not proper, or it was not started after 6 months of age. After 6 months, the breastfeeding is not the adequate nutrition required for the baby. It needs more, not just breast milk. So complementary feeding is compulsory to be started from the seventh month. Right. Moving on to the next one, question number 15. If the babies in the US are growing well with the formula feeding, what's the risk in using formula for babies all over the world? It increases the risks of allergy, asthma, diarrhea, obesity, etc. It is too nutritious. It will make the babies very tall. There is no risk, and formula should be fed to babies. Okay, this is a very debatable thing. Um, I am a student, so I just know it through what bookish language I have learned it. I'm not sure of how many people here are married, are having babies, and what they generally opt for. We can know their views through this discussion as well, if anyone wants to share anything. Do you think formula feeding is good for the baby or not? Do you Is anyone there who is a mother and they have gone through that phase? They can share their experience as well. But only through the chat box. Please, let's not unmute yourself, because if many people start talking, it will be a chaos. Okay? But if anyone wants to share anything, they are most welcome. This is not just a strictly assignment class. We all can have our thoughts and views discussed, whoever wants to say anything. Okay, someone shared. Let's see. I had formula fed by baby, but at 3 months I had started a proper diet, so did not face any challenges. Still, I will not suggest to use it. Okay. Many cases of diarrhea after starting formula are reported. Yeah. Yeah, till 6 months, obviously, it is not recommended that you are formula feeding a baby. It maybe some babies are immune, have more immunity, and they may not face any issues. But generally, if we say the babies don't need anything else more than breast milk for till 6 months. After that, you can start with complementary feeding. Still, formula feeding is not suggested. Yeah, when you go through C-section, many times you need to give formula. That is true. Okay, I'm happy that people are sharing their thoughts. They even gain weight drastically, which is unhealthy. Yeah, yeah. Obviously, if you're formula feeding, the proper hygiene of bottles, cups, the nipples, everything is like you have to take care of the hygiene. Otherwise, it can obviously lead to allergies, diarrhea, etc. Right? So, yeah, so with this discussion, I think everyone knows that the correct answer is A, right? Although US babies are growing well with formula feeding, but it's not mandatory that all over the world there is no risk for formula feeding. There are cases where it was observed that formula feeding leads to allergies, asthma, diarrhea, obesity. So yes, it is not recommended. Moving on to the next one, question number 16. Why do some malnourished children don't recover completely even after giving them the prescribed treatments for malnutrition? So the treatment is not right, they need more exercise, they need more calories, or they are chronically malnourished from the start due to ineffective breastfeeding and improper complementary food. I hope everyone is actively answering. 100 answers I need for each question. Okay? So don't just sit idly. Let's participate actively throughout this Q&A session, right? Okay. What is the exam pattern? Can you explain? So, as I told, I am not the concerned person for the exams. I won't be like designing the question paper, but I think for the exam pattern, it is MCQs as well as subjective, both. So, both are important. Let's see what is the correct answer. The correct answer is D. They are chronically malnourished from the start. So malnourished children don't recover even after if you give them start giving them proper nutrition after a few months, because from the start they didn't get effective breastfeeding or complementary food in the first 1 year, which makes them chronically malnourished. So it is very difficult for them to again become healthy. So that's why it is always said that the first 1 year of the baby is very crucial so that it grows properly. There is no stunting, there is no wasting, there is no malnutrition. Right? Okay, moving on to the next one. Can low birth weight babies grow properly with effective breastfeeding? No. Yes. Only if the mother is not underweight. Only if it is combined with complementary feeding in the first 2 months. Start answering question number 17. Okay, someone has written something. I think I missed it. Let me go back. Okay, let's see if this is the correct answer. What is the correct answer? The correct answer is yes. Yes, low birth weight babies can grow properly if they are given effective breastfeeding, right, for the first 6 months. So it is not an issue if your baby is born underweight or overweight. The weight can be managed if they are given proper nutrition for the first 1 year, right? Okay, moving on to the next. What can mask severe acute malnourishment or very low weight for height in children? Stunting, high lean mass, proper complementary feeding, proper breastfeeding. So read the question properly and then answer. Okay. There can be. Okay, let's see what is the correct answer. The correct answer is stunting. What can mask severe acute malnourishment or very low weight? So if you have stunting, it can mask that the child also has acute malnourishment or very low weight or height for the children. That is called as stunting. Okay. So mask doesn't mean what can cover up for your malnourishment, not that. Okay. Okay, so this was the last question. So, yeah, let's see. So, the total number of questions were 18, right? So, out of 18, what is your score? Please type in the chat box. So, please write 16 out of 18 or 17 out of 18, whatever. Okay, 16, 17, 15. So, I guess everyone has just given one or two wrong answers or maximum three. It's all good. Many people are reading properly. Yeah. Okay. Okay. 13, 14 also I can see. Late joined. Okay. Whoever has joined late, not an issue. Like please go back. I'll upload the YouTube video, then you can go through the session once again. Okay. Whatever you have missed. So for that, I will be requesting you all to please be on time. Okay, so that I can let you join. So today the problem which we all faced was after 100 I am unable to accept anyone. So if you joined late you have to suffer. So if you want to prevent that situation, please try to join by 7 or before 7. I am there. I join by before 5 minutes. I join by 6:55. So if you are there, then I will accept your call. You didn't get the mail for the lecture. Okay. Please, you can. I think in the NPTEL website there is a help option. If you are facing any issues regarding the lectures or the mails, you can contact them. Like I am not the concerned first person for that, but I can show you the direction where you can do it. So in NPTEL website for your course, when you go, you can ask for help. Also, there is a discussion forum. That option also is there, discussion. You can join the forum and also ask your queries there as well, anything related to the course, exams, whatever. Okay. Okay, I don't think I saw 100 people giving their scores here. Anyone missed? You can still type. I'm giving time. Or if there is anyone who could not track their number of incorrect and correct answers, they can also let me know. But you should be careful from next time. Okay? Could not track. Okay, could be 8. Okay. So, two things are important if you want to track. Uh, that first join on time by 7:05 maximum, and then please keep tracking. Okay, it was also my mistake that I did not say you all earlier that keep tracking your marks. It was my fault, but yeah, whoever could track, great. Whoever could not track, no problem. Let's follow it from the next session. In final exam, what is the pattern of the paper? Okay, as I said it, that it will be MCQs as well as subjective, both. I think so. Okay. Yeah, I think it is the pattern followed from the previous years. So yeah, I think this year also it should be the same. Whoever has joined this course, they can go to about course and read. There are many things written and it will probably answer all your questions. Okay, so no need to ask here. I think you can get the answer to your questions if you read that about course wala page. Okay. Okay, didn't record, probably 16, no problem. Anyone else who wants to say their marks? Okay, could not keep a track. Okay. The last date is also given in the assignment. You can go and check it there. Okay. So if you open week one's quiz above only in red color, I think it is written this date is the last date with time. That this is your last date to fill assignment one and submit. So make sure you are not missing your assignments, you are submitting them on time. Okay. I think already for week one and week two, the assignments are already available. 14 out of 18. Good. Good. I am happy that at least every one of you have scored more than 50%. Okay. So that's good. Very good. We will try to improve our score in the upcoming sessions. So, yeah, as I told at the first, it is very, very, very important that you attend the lecture of that week and then join the session. If you have not attended the lecture, then obviously you will be at loss because you won't be able to understand the questions as well as you won't be able to answer them properly. So, it is very important that you attend the lecture and then come to this session. Okay. So the session is on Tuesday from 7 p.m. So before Tuesday, at least by Monday, try to go through week 2 lecture. Now I am saying, okay. No, this is not. This is for the week 1 lecture, not for the second. Marks was less in percentage basis questions. I could not understand, Archana, what you're trying to say. Uh, yeah, your marks became less because of the percentage basis questions. I understood. Okay. Yeah. So, yeah, so there are these percentage type of questions which you have to memorize. There is no other option. I think you will face a few of them in the next sessions as well. So, yeah, if you go through the lectures, I think Rupal ma'am has discussed everything. And I will also try from the next session that I bring in more information for you all for each question so that we all can make sure that you uh, understand the concept as well as remember the answers, right? Is there anything else I can help you with, or should we dismiss for today? And today was the first class for this year, and I was very happy with the attendance. And yeah, all of you are welcome to the class every Tuesday at 7 p.m. Please be on time. And yes, we will have a productive 1 hour or 1.5 an hour session. Okay? Okay. Thank you everyone. We'll meet next Tuesday again. Okay, please be on time and attend the lectures. Okay, don't forget to attend. I no need to share here. I will upload the YouTube video. My channel is already there. I think NPTEL people will already notify you with the channel details. Okay, by any chance, if you have not get not if you don't get the notification this week, then next Tuesday I will give you my link. Okay, lecture time is 7 p.m. to 9 p.m. every Tuesday, not daily. Okay, lecture time I don't know. I think they are uploading on the website. I don't know the live session, live lecture time. I don't know. I lost track. Is it? Yes, you can recover it because I'm recording the session. I will upload this recorded session in my YouTube channel. Then you can go through it once more. Okay. So no need to worry about that. People are still trying to join. It's already 8:30. There is no point of joining now. So whoever was late, please make sure you are on time from next week. Okay, so that you don't miss out on anything. Okay? Okay, so I will disperse. Okay, we'll meet Tuesday, next Tuesday. Okay, bye, good night, take care.